I love it. Me too.
You never
I
cook
love
for
cooking.
I'm sorry, Zach. We haven't hung out in like a year.
I know. When you come down next time,
I
you gotta
know.
cook for me.
It's always been stressful. We can have a big old cooking party.
Yeah.
I love it. All right, so let's get started, guys. So we have a couple questions that are specific to Women's History Month, so I definitely want to get to those, and then we'll get to some of the questions that have been submitted. And then again, girls, if you have any follow-up questions, put them in the Q&A box, not the chat box, the QA box, because that'll pop up on my end. Dr. Sharma and Simon, you guys don't have to worry about clicking on anything. Just hang back and hang out and be honest, truthful. We want to be very transparent. And we want to make sure that, you know, we are coming across as honest as possible with our students. So let's get started. Okay, so Dr. Sharma, what does being a strong female leader mean to you?
I mean, the feminist in me always says, don't use the word strong female leader. A leader is a leader, right?
Absolutely.
You know, it's a very interesting thing because it's actually looked at like that. I personally would say in the beginning of my career, I would probably struggle with it a little bit. Just in general, you know, things are changing. World is changing a lot. I think as in today's date, I don't feel it at all. But in my beginning years, it was a little more struggle when, you know, people think about the dentist as a female. Like I had some weird eyes about it. Even the staff would be, especially when you're fresh out of school. I mean, and who gives you leadership 101 in dental school, right? No one. So I just think that, you know, stepping into the role, you have to actually put back anything about female or male. You're the leader in the practice. You lead by example. Your team should look up to what you're trying to do, and you just have to set up examples for everybody. You know, teach what you preach. It's always, you know, as the leader of the practice, the whole team actually looks up to you, and your behaviors and the way you do things are the setting examples for everything, how everything in your offices is always going to work. And it should never be, it should always be, a relationship should be more of a respectful relationship, not more so of as an intimidating or I'm scared of my boss, which a lot of times females tend to come stronger females, as they say, come across as, you know, I'm scared of her. I think a good relationship is where your staff respects you and follows everything in because of the way they respect you and not because they're scared of you.
Absolutely. And I can attest to that, Dr. Sharma. Your team is solid and they love you. And you guys do so much together and you lead by example. So praise to you for that. That's awesome. And Dr. Saman, how about you?
So the
question is, what does being a strong leader mean to you?
You know, it's kind of crazy. Like she said, you don't really learn much about leadership in school. I've always been a person to kind of talk a lot, and just like my team can definitely say I get annoying sometimes, but I never realized how many people look up to it. You know, most of my office is almost all female. I have 2 male doctors and then a male lab tech, but everyone's a female, you know, everyone's female, and the patients love seeing a strong leader, and they love that everyone respects you, and then they look up to you. And you know, I have a lot of people in my office are actually pre-dental, and so guiding everybody into showing them what women really were capable of, and seeing that, I think it's special that we have the ability to, I mean, we're a little bit more, you know, compassionate, maybe. I don't know if we can say that compared to other, you know, a male leader. I don't know if I'm allowed to say stuff like that, but patients will definitely let you know why they prefer going to you and why they feel comfortable and why they feel like the office has this vibe of friendliness and love. And I think, you know, showing them that anybody is capable of being a good leader, you know, and it helps for people to see that you don't have to be certain sex to be a good leader. And right now in our world, we're seeing that slowly and surely, but I never expected everyone be so positive and look up to us in that way. And I get so many people that will say something, they'll pull me aside and say, I love that you are this awesome leader. And thank you for showing me that we can do it just by being kind, treating people right, doing the right thing for the patients, teaching staff. You know, most of my staff can repeat everything I ever say to a patient. They understand why we take care of the things we do. And it's just fun to lead by example. And like she said, it's not an easy job because sometimes, you know, we are females, and they'll say, you won't call a male the B word, but if we're a little bit, you know, stronger, then maybe it's that they look at us that way versus the other way. So just stay true to yourself and you know, be honest with your team, like you said, and you gain that respect and you have fun. I love to have fun in my office. I know Dr. Sharma is the same way.
Yeah.
Environment really fun, and I love leading teams. It's like that's the funnest thing I think Aspen has given us, is the ability to grow teams and lead them. Oh, hi, Doc.
Hi. Webster, Dexter, Webster.
Dexter.
Hey,
Hi,
Dexter.
Hi, Dexter. Hi. Okay.
I love that.
Yeah.
That's 2 minutes of fame.
Did he want to answer the question about being a strong leader?
Yeah, you see that? There's no strong leadership in this house besides him. That's
I love it.
He dominated it.
All right, awesome. Those are both great answers, guys. We have a flurry of questions that are popping in already. Okay, and ladies that are submitting the questions, if you could please do me a solid and put them in the Q&A box and not in the chat, because otherwise I have like 10 boxes open right now. But I will get to all those questions. So we have a few that have popped up. So let's get to these. I didn't get to eat dinner yet, so I'm a little frazzled. Okay, so this question's a good one. We'll start with Dr. Sharma. Being a female in dentistry, can you talk about working while being pregnant or breastfeeding?
I'm the worst person to ask that question.
Can't answer that question.
You guys neither have been pregnant nor breastfeeding, but you do have hygienists and DAs and other women in the office that have. I remember that the hygienist was pregnant while I was in there.
Speaking of which, yes, we just celebrated baby shower for one of my dental assistants today, and it was beautiful. So again, just as Rebecca said, both of us, me and Dr. Siman, we haven't been through that journey. So when Dr. Khadija pops up, you should ask her. She's a super mom, superwoman. So I always tell her I don't know how she does it. But I think we do maintain a very comfortable workspace for everyone. We have had employees, as I said, hygienists, doctors, and DAs who have been pregnant. They've worked all through their pregnancy. The staff is very supportive. We celebrate all these new things in their life. We get together, we have a lot of fun. My hygienist actually came back to job 30 days, maybe 45 days right after she had the baby. We had a designated area for her, closed door space for her privacy, for her being able to come and do everything. So we try to maintain a really good balance. I've also accommodated hours for my employees, especially the ones when they get towards the later phase of their pregnancy. We've been always helpful about giving them the time off that they required, even if sometimes some of my employees who have worked with me for long term, if they need more time than what normal allowed time is under, what FMLA laws and stuff are, I've been more than happy to accommodate all those needs for them. I mean, it's an important thing in life. And for me, how I've seen, I think women are very strong and they have this ability to multitask and do all these things together. And I have not seen, and I'm talking on behalf of so many dentists in Aspen Dental that work. I mean, these amazing women have their families, have their kids, and have been able to pretty much do everything and not take a break from career. I know sometimes people think that happens, but we are all strong enough that we can handle it.
Absolutely.
I mean, ask Becca how she was dancing on the floor and pretty much on her 8th month.
I was getting down and dirty when I was 8 months pregnant, guys. So piggyback on Dr. Sharma, I was very much pregnant. And I had tons of support from my Aspen directors, from my VPs. They were very supportive on me taking the time that I needed, working up until I was comfortable. I worked up until I gave birth, just because I felt like I was healthy and comfortable to do that. And then when it was time for me to take my time off, there was no questions asked. And then I came back when I was ready. You know, obviously you get your allotted time, whatever, like Dr. Sharma said, it was 12 weeks or 8 weeks, depending on LA. And then, you know, but they were very much on board and supportive of all that. So that was a great question. We had tons and tons of doctor moms, super moms. Dr. Khadijah has 1 or 2?
2 kids.
2 kids. 2 kids, works full-time, managing clinical director. So it can definitely be done, and it's done all the time. Dr. Saman, do you have any input?
I think you guys covered all of it. I mean, my hygienist, you know, she worked until she gave birth, and she took only a short time off too. But you know, we gave her that private room to pump, and we love when they bring their kids. I love when my staff brings their kids to work. It's whenever they're like, "Oh, we don't have a babysitter," I'm like, "Please, I'll babysit. Like, bring them to the office." Not mine. I would love to take care of it.
I don't laugh for that.
You don't? Oh, I love
Dr. Sharma's lying. She met my child and she was wanting to take her home. So don't let her.
Poor child is the cutest baby ever.
I just made her send me a picture.
I mean,
she's like, send me a million pictures of your baby right now.
I know, she is the cutest baby ever.
No,
I mean, I have not, I mean, when it comes to babies, I have not seen a, like, touch wood, a happy baby like yours. Like, I'm like, this baby does not cry. Like, there's something like that? Like, babies don't cry?
It's crazy. I mean, I'm just like, how are you not a little jerk? It's crazy.
She's
so
not.
You're ladies, you're capable of having some great babies.
For sure.
Yes.
Yeah. Everyone I know, and almost most of our owners, I mean, they all have maybe three kids.
Yeah. Our owner doctors have families, so definitely can be done. Awesome. That was a great question. Okay, next question. You guys, these questions are rolling in. I love it. Hold on, there's tons. Okay, next question. Have you ever faced discrimination as a woman on the work field, school? If so, how did you respond to it? Dr. Sharma.
I honestly, I have not faced any kind of discrimination. I think the only experience I can relate to is, you know, more so from patients. I think that's probably been the only, like, when I was just fresh out of school, you know, people would like stock me up bottom to top and then just be like, you're going to take my teeth out. And I would just always make a joke of it. And I would just say, you know, powerful things come in small sizes. And when I would be done, people would be amazed. And I think I believe in like proving yourself. I'm a very strong believer of that. So, and I love that. Now it's the other way around. People come in asking for female dentists. Like, world is changing so much that everybody comes in. Like, we have people come in at the front desk and they ask for, do you have a female dentist? You know, they don't want to work with, no offense guys, but I think it was a very male dominated industry to start with. And then as females have started coming, they've established themselves. And now recently, I think people really respect you, and also when they see your work, they are just so amazed. I've had tons of male doctors with me, and I've always been respected by them. They are, you know, I guide them, I coach them, I mentor them, but they always look up to it and have been very, very respectful. So I think the journey forward is very positive in that direction. I hope, and I would really want that none of us going forward have to ever experience any kind of discrimination, you know, like that.
Natalie, have you ever experienced anything like that?
Not in dental school. You know, my dental school is mostly female. Actually, I feel like with 60% female. I only had maybe 2 patients, very, very older male, did not believe me that I was a dentist for
They're like, are you sure you're not the dental assistant?
it was like it took a while. But that was early on in my career. And when you become a more, confident leader and dentist, no one questions anything anymore. I have, like I said, 2 male dentists who I love to death, and they respect me, and I know they do. Everybody respects us, and patients do. They not always prefer, but a lot of times now, I don't know if it's because of the history of, years ago, they have all these horror stories of the dentists, how many years ago. So they're a little more comfortable sometimes in a situation where they can feel comfortable talking about it. And I'll spend a lot of time talking to every patient. But I've just that once or twice early on in the career when I think he just didn't believe that women could be doctors. And I don't blame him. It's, he probably hasn't left his house in 30 years, but so after that, though, once you get that confidence in your ability to talk, every time I walk in a room, no, not one time has anyone ever questioned me. And I don't even get are you old enough to be a dentist anymore? Because I used to get that a lot, but now it's kind of, I don't think people feel that way at all. Once they meet you and they talk to you and they understand that you know what you're talking about, and it actually feels really nice. So
that's awesome. Awesome. Okay, so this is another question. This was, I think, more specific to when you start working. Mm-hmm. Is it possible to pay back these loans without living like a dental student for 5+ years and delaying starting our lives as women, getting married, having kids, etc.?
Who wants to answer that?
Who wants to answer that?
I can start. Yes, definitely. I haven't finished paying my loans, but I'm actually getting close, I would say. And I graduated, almost 3.5 years ago. I would say my goal is 2 or 3 more years. And I've definitely been living a little more lavishly than I expected to, but saving 70% of my money. And I'm not married. I don't have kids. So for me, my focus was business, buying businesses and paying off my debt. And there's a lot of people that, a lot of my friends that are dentists, they are paying the monthly, or what's it called? Pay as you earn, or pay as you.
Yeah.
And they're paying a minimum a month, and they just bought homes or having kids. So you can do both ways. You can pay big and get rid of your loans in a couple of years, which is really my goal, because the interest is high and I have nothing else to do with it really. And then the other people are, living their lives and paying monthly and in bigger chunks as well. But yeah, it's definitely doable. And people will say that it's not, but for sure is. You work hard. We work hard and you pay it off, and you can live and enjoy yourself for sure.
Yeah, it's doable. Dr. Sharma, are you done with your loans yet?
Absolutely doable. Oh yes, long time back.
Awesome.
So I would say, I think just as Natalie said, it really comes down to how you want to prioritize. Mm-hmm. One fun fact there, trust me, when you get your first paycheck, you will not feel like you're a student. Okay, so don't be worried about that. I lived like a student. When I was a student, I did not spend on a lot of things. And when I graduated and I started working, I wouldn't say that I was living like a student. Oh, Dr. Khadijah's on.
Ooh, Dr. Khadijah's on.
Yay. So I wouldn't say I was living like a student. I was still traveling a lot. I was doing a lot of things, but I did have a very high priority on paying off my loans. And I actually was able to, I think, maybe comfortably do it in 2.5 to 3 years is what I would say. But of course, you can't pay loans if you're at work. If you want to hurry them up, you can't be working on the minimum payments. I was paying a bigger chunk to kind of get it off. But I don't think that ever stopped me from living the life how I wanted to live. I just wanted to get it off my head. That was the only thing. And it's absolutely doable. Please don't ever think that you will not be able to enjoy your life or you will have to stop. Do what you want to do in life. Loans will always be there. One loan stops, office loans comes in, home loans come in. These things will always go on. But you will have the ability to keep doing the things that you want to, and you don't have to put anything in your life on hold. Ask Dr. Khadijah, she is here.
Hey, Dr. Khadija. So I told her that she's welcome to jump on her drive home, so she doesn't have to turn the camera on. That's
Okay.
probably why. Are you heading home, doctor?
I am home. Yes.
Oh, you're home.
Yes,
Okay.
I'm home.
Then turn your camera on, girlfriend. We want to see your face.
I am not sure. I did select the, what do you call?
The camera?
Yeah, I did. I'm not sure why I'm not.
Jump off and then try to jump back on, because right now it just shows you as a blank screen.
All right, let me do that.
Okay. Okay. So while she's doing that, we're going to go to the next question. Okay. So next question. Did you find or have a mentor ever mention that being an image? Let me read this again. Did you ever find or have a mentor ever mention there being an image expectation of outfits versus scrubs, nails, makeup, etc., from colleagues or patients, and how that could or feed into a patient's acceptance? Okay, I understand the question. Do you guys understand the question?
I do.
Yeah. Okay. Who wants to answer that? That's a good question. I mean, did you ever feel like you had to dress up or feel a certain way so that patients would accept you, respect you, see you any differently?
I was so done wearing scrubs in dental school. I told myself I'm never going to wear scrubs. And I used to dress up for work. That was a personal choice. However, since COVID, I've actually transitioned to scrub life. So I was not going to, come home and do my laundry every day. So I just bought a bunch of scrubs and now I'm living the scrub life. And I have actually realized how much I've missed them, how much easy the life is with them. So now I do more of a scrub shopping. But no, I mean, I put on my nails, I do everything. Um, I don't think putting on makeup or you just have to be professional, right? I have bad hair days. I tie up my hair. You just do not want to, and that's not just for you, that's for everybody in the team. We work in healthcare. We just want to look professional. That's it. I don't wear makeup anymore when I go to work. I don't have the time for it. Most of the times I like to sleep in instead of waking up and doing my hair and makeup. But again, be you, do whatever you want to do, but don't do it because it's going to change your acceptance or it's going to change how people look at you. I think it's more about how you treat people more than how you look or how you present yourselves. It's always going to come down to how you treat people. People will love you and trust you if they actually really understand that you are with them and you are going to be with them in this journey, and they will move forward with you more based on your personality than anything else.
Mm-hmm. I agree with you, Dr. Sharma. I used to think that I had to do like this makeup and my hair was always perfect, and I would dress up sometimes and I wear my nice white coats, and then now I'm more like this. No, but I realize you're right though. It doesn't actually matter how you I mean, as long as you look presentable. I always have my nails done, and right now I don't, but as long as they're neat, no one's gonna look at you. I mean, you're wearing gloves 90% of the time. But I think, yeah, being comfortable in the way you look is important though, in a confidence way though. I feel like if you dress nicely, I think you always feel a little bit better. I actually have my own little makeup thing at my office just in case I like wake up and I need, I think I look more just awake if I have a little bit on. So I have my little set at work because then my office is like, are you tired? I'm like, no, let me just put my face together a little bit. But I do dress up Fridays. I do certain things. I mean, with COVID, we weren't like supposed to wear regular clothes for a while. But I start to do it a little more, and I love doing it. But when you have big surgery days, it's not very feasible. I don't know how you used to do that, Dr. Sharma. I'm sweating through my silk shirts.
Girl, I used to be in heels and dress up. I did the whole spiel.
I can't
I can't anymore. I can't.
Sometimes I put my gym shoes on in my dress clothes because I'm like, how do people do this? But I do think
I'm always in gym shoes now.
Yeah, I do think it's nice though. It feels good when you do dress up. People are just like, whoa, like hello, like it's nice to do that sometimes, But
they're like, where did you come from? You work here?
Like, exactly. Yeah. So I do like doing that, but you're right. I mean, it gets exhausting, when you're working a lot, and you're not always going to come out looking like that every single day. And it is nice, people who respect you being real as well. I realize it's literally like there's two types of people. Like you being all dressed up can be a nice energy, but then you being yourself and just being like a normal person, actually, sometimes it's more comfortable for patients. So I noticed that as well. So I would say you can do either one for sure.
Yeah, and you know what, guys, girls, especially our dental students, the office is like, there's no set structure, right? There's Dr. Sharma, I've seen you in scrubs. I've seen you in cute like tops and like heels. You can do whatever you feel comfortable with. They're never going to tell you you have to wear this or you have to wear that. Like, dress up if you want to be in scrubs, by all means, you wear whatever you feel comfortable with. Dr. Khadijah, for whatever reason, we still can't see you, which makes me really sad.
I know, I'm trying. I don't know. One of these, like, you know.
Yeah, it's one of those tech days.
I really wish I was tech savvy, but I'm not.
It's totally okay. We're so glad you're on. We did have some questions regarding, you know, what was the question? Let me see if I can go back. Because it was a good question for you. I know Dr. Sharma and Dr. Saman were like, don't have kids. Can't really answer that. Being a female in dentistry, can you talk about working while being pregnant or breastfeeding? What was your experience with that?
Oh, wow. Okay. Yeah, so I did, so let me tell you a little bit about me. I did do my schooling, my original degree when I was in Pakistan. I was born and raised there. Then I got to US when I married my husband, who's a US citizen. So I kind of had to, you know, change my whole life around and do all that stuff. I got here and I started working right away as a DA to build up my resume. I was working part-time and I was studying part-time for my exams. And I took my first national board when I was 8 months pregnant with my son. And I took my second national board when my son was 6 months old. And then I got into school the first cycle I applied, and I actually got pregnant after the first semester with my second child. And
no time.
Those who are in advanced program, they know that that is the most difficult semester, the two difficult ones. So I was pregnant around that time, and I don't have family here. It's just my husband. My husband works full time. I had a toddler and I was pregnant with my second child without any help. I did it all, and I did do it. I was able to do it. It is just that because your body gets adapted to, you have no idea how incredible a human body is. You just get adapted to. If you get 4 hours of sleep, because that is how much I was getting, I just got adapted to it. There's no other way. I knew that the baby's coming, can't do nothing about it. I knew that I was already in the school. I had to finish it. So what was my option? I just had to work with whatever I had, and I did. And believe it or not, me and everybody, because in international programs, usually, you know, people come from other country after some various degree of experience and many years in dentistry already. And then they come to this country and then they do this all over again. So they are a bit older generally. So they did have families, and all the mothers were one of the best in the class. All the mothers, all our honor students were all mothers. All the in the previous batches also, they're just overachievers because they just know how to adapt really well. You know, I believe it or not, all the track students, honor students, all the people that graduated with extra credits, they were all mothers. So life doesn't stop for anything. I did not think that I wanted to hold off everything. That's what I really originally planned, but things went against my plan, and I'm okay with it now, honestly speaking. My daughter was newborn, and I did the whole year of schooling after that as well. So I'm able to do it. And let me tell you, I've never failed any exam. Okay. So if I can do it, anybody else can do it, and you can do it. And I worked with Dr. Sharma for a year. We've been together working for over a year and a half now. And I started, my first job in the US was in her practice. Skokie, Aspen Dental Skokie is a very busy, very thriving practice. I started with her. It was her and me in the beginning, and we worked, and I was able to do it. So I'm pretty sure everybody's able to do it. So, you
No,
know,
she's a superwoman, I'm telling
I was
you.
gonna say, if there's a will, there's a way, and Dr.
Yeah.
Khadijah's out there
Yeah.
kicking butt.
yeah. But the thing is, think about it. The situation that I was in, anybody could be in that situation. And when you are in that situation that you are already in school and you didn't plan another child, but now it's happening. What are you going to do? You're not going to drop out of school. You put so much work into it, and there's so much time invested into it and so much money invested into it. Why would you just, then you got to be just play your strong points, so just I think it's doable. When I was in school, like all my colleagues were like, dental school is so hard on its own, how are you doing this? But I'm like, well, what other option do I have?
Let me tell you, I don't have a choice.
Uh-huh.
That's
Figure it
exactly
out.
what it is. That's
That's
exactly
awesome.
what it is. Yeah.
Okay, so very doable. Dr. Khadijah did it with 2 children, and you're killing the game. So I love it. Okay, so quite a few questions, guys, that have popped in. So let me go in here because there's one on this side that's hiding. Okay, what are the best and worst aspects of being a female dentist? Both panelists have lived in multiple cities in the US. So on general, Aspen, no. Does Aspen allow great mobility within the US between licensing and practicing? Dr. Sharma, how did Aspen accommodate your move from San Francisco to Illinois?
Oh, my big move. Yeah, no, actually, honestly, they're very supportive about it. You do have to, I think all of us have had a journey where we've started in, sometimes in harder areas, in remote areas, in smaller places. But when I was looking forward, I was graduating from California. I was not going to get a job in California. I knew that. And I was open to moving anywhere. They were very supportive. They helped me through the whole transition. I actually even got a relocation bonus at that time. So those things matter when you're graduating from dental school. I had no money. I had no money to do a cross-country move, but they were very helpful. And I think, a lot of times people have asked me about, because I interviewed with a lot of DSOs, and people have asked me about like, what made you actually pick Aspen Dental? And I think one of the reasons that I always relate to is how warming and how welcoming I felt when I interviewed with Aspen Dental. They flew me twice from California to come and just look at the practice, just to feel it. And those things matter. You're going to make a decision. You're making this choice for your future job. It is important that you feel that you're valued. It should never feel like, oh, this is a business transaction. The interview should be more about knowing you. So they were very supportive, and that was one of the reasons I was like, okay. I mean, they made me feel that they value me and they need me, so I'm just gonna go work for them. That's how I started. But with all the other interviews that I had, I did not have that experience. It was just like, oh, if you want to sign the contract, we'll fly you so that you can come and look at the office. But it was totally opposite with Aspen. It was just like, no, just come and feel, see if you like us, see if you like the place. And then if you do, then we can talk about where you want to be. And yes, I mean, moving from where I was in Central Illinois to coming to Chicago, it was a very great move, and it worked great for me. But they were very supportive about it. I was opening a brand new practice in a brand new market, so it was a little scary. But I think they believe in people. They believed in me. They believed that I could do it, and I had the support to do it, and I was able to do it.
I love that. Now, Dr. Saman, you went to Midwestern, you worked in Bourbonnais for a little bit, and then you decided to make the move back to Michigan, right?
Yeah, I really wanted to become an owner. And I asked, and I wanted to either be in Illinois, Dr. Sharma, and all my friends, or in Michigan where my family lives and, my siblings are, which is awesome. So, based on the market in Illinois, I was, sent here. They offered me the opportunity, which is amazing because there is already people here as well. So I was able to get a spot. They believed in me, and they, it wasn't easy. It was definitely not easy for the, people were, to become an owner early in your careers, it's exciting for the person, but people around, it's hard to come into a market. Aspen has multiple offices that growing every day, but it was difficult. So, but the way they made it easy for me was, obviously offering me my hometown, 7 minutes from my parents' house, which is insane to be able to come, all across the country, the whole entire Michigan. They offered me this, this area. I don't know if anyone's from Michigan here, but like 13 in Woodward, which is the prime location. And I was like, this is the best opportunity I could have ever asked for in the world. And I mean, I didn't need the help moving here. I mean, my family lives here. I was sad to leave Chicago, but it was either, work as an MCD, in the middle of nowhere in Chicago, or, own my own practice and start building my life, which is what I did. And they were 100% supportive. I'm so lucky. Every day I'm thankful that they gave me this opportunity. And then, opening another one the year later, it's exciting. So, and they give you, if you talk to, the CEO, the other people in the company, they tell you that you can do it. And I know Sharma, we spend a lot of time together with everyone, and they make you feel so strong. And by someone telling you that you're amazing and you can do these things, it just helps you really believe you can. And look at us, you're becoming successful and opening practices, and the support is amazing. I tell every person you ever hire, you can go look online or talk to any person and ask them. You will get a support in any single thing you want or need, whether it's from HR to this to that to location to implants to Invisalign. Like, there's so much that they offer and they help with. I think every student out of dental school should work for a company that can give you every single training resource possibly without even having to look it up on your own. And it's not all free, but a lot of it you don't have to really pay for, with all of our Invisalign stuff. I mean, now we're doing the implant stuff, and then they're starting to do the Botox stuff. And just so, I'm so lucky that was my first job, and it's gonna be my only job. I was like, so.
Oh, I love it.
Yeah.
I remember when you reached out to me, Dr. Saman, and you were like, when is Aspen going to start doing Botox? And I'm like, I don't know, but hopefully soon so I can come see you. And then, a couple months later they announced it. And I'm like, Dr. Saman, we're going to start doing Botox. Mm-hmm. So, I mean, there's the opportunities are endless, right? And like you said, we offer tons of CE courses. We offer tons of different opportunities for training. So it's out there. We have a lot of support, guys. And that kind of rolls into this next question. So one of you guys asked earlier, I want to make sure there's tons of questions on here, guys. So I want to make sure I get to as many as I can. Someone asked, did any of your classmates have children during school? Did you find it hindering their learning in any way? I mean, Dr. Khadija, you kind of answered that, right? You said most of the moms probably did the best.
Yeah. Most of the people were married with kids in my class, and it's not just us women. Right. There were men also. Their wives were not working. They were full-time students. They had kids, but they managed it. Believe it or not, money is a big part when you are in school. These are real hindrances in life. You just have to understand what are the pros and cons, and if you have to adjust and change your lifestyle for a little bit in order to gain something that is a lot bigger, that you have worked for a big part of your life. And these are people that it's a big thing. It's a bigger change. You got to understand their perspective. These are guys that I've known that were oral surgeons in their country, so successful, but to have a better future for their family, they moved across the world and did this and made this happen, and all the changes that their family was also going through, but they made it and they did it. So that is honestly, I feel like whenever I looked at them, I felt like their situation was probably a lot harder than my situation. Mine was definitely physical, mental stress, all that, but my husband was working full-time, bringing money home, so we didn't have to adjust or do so much around our life to do that. But even in those situations, people do it. So trust me, having kids while having or going through school or working full-time is really not end of the world. It is definitely manageable.
It's doable. Okay, awesome. Now, okay, so because we have so many questions, guys, we only have 15 minutes left. Time is going really fast. I'm going to ask these questions specifically to you guys because some of them are specific, right? So this next question is, what was the best part of dental school and the most difficult part? Who wants to answer that?
I'll let you two go. I feel like
Who graduated the most recent? Dr. Saman?
no, I think Dr. Khadija.
I
Dr.
graduated in
Khadija?
2019. Yeah.
Okay, so you are the newest grad. What was the most, well, I forgot the question again. What was the most difficult part of dental school? And what was the best part? The best and the most difficult?
The difficult part is honestly because all of us come for me, I'm from a I'm a foreign trained dentist, so forgetting all the background knowledge and kind of doing like resetting the whole thing and sort of like working into it and all that is definitely a more difficult part. But once you get used to it, that becomes the easy part as well. You feel like you are redoing the whole thing and you learning new things, and I feel like I came here and learned so much new things. I did enjoy that a lot. The patient experience was very good as well for me. So that was the best part of dental school for me. But I feel like in the beginning, dental school in general, I feel like when you are learning, you're getting so much knowledge in the first 2-3 years, and having to just go through the school itself, like just getting there day by day, doing clearing the pre-clinicals and all that is maybe like a little bit difficult in the beginning, but then that actually becomes the best part when you get used to it, or to me, I guess that's what it is. My experience was different. I'm sorry, guys.
No, that was fine. Totally fine. Perfect. Now, Dr. Sharma, dental schools don't have time to teach you business management. How did you gain the skills to successfully run your practice?
Yeah, come, I'll teach you business 101. No, I'm just kidding. I think it's a very personal choice. Honestly, when you work with Aspen, you don't need to know a lot of business skills. It gets better with time. When I started working, I had no idea what I was doing. I couldn't understand how things work. And absolutely right, nobody teaches you that part. There's a lot in that they don't teach you in dental school. Dentistry in real world is very different than studying from books and working on mannequins. Um, so I'm a very statistics and maths person, so I started peaking more interest in it myself. And even before I became a practice owner, I did understand a lot of things about business. I think it's just one of those things that once you get into it, you start understanding it better, and it's how much you have the will to learn in that direction will take you in. You have support if you need to reach out to people, how this works. You have your regional manager, you have people above that. They're always going to be helpful in telling you how the practice metrics works, how the statistics works. But the more you kind of get into it, it gets better. And I think Dr. Khadija can probably talk about that. She's going through that little transition right now because she's leading the practice and she's doing it all on her own right now. And she's kicking butt. I don't know how she does it, but she's doing amazing. But she's understanding that a lot more. While she was working with me, that was not a part that was more on her shoulder, but now she's running it all by herself. And, when you get into it, you just figure it out.
Right. Well, a lot too, guys. I think a lot of our students don't understand that at Aspen, these amazing women are practice owners. And then Aspen Dental Management, we offer the support and the business aspect. So they can be as involved or as uninvolved with the business and the day-to-day as they want, because you have the support and you have people doing all the business for you. But like Dr. Sharma said, if you're interested in the statistics, if you're interested in learning, what's going on, and if you want to be more involved, then you're definitely welcome to. But if Natalie said, you know what, I want nothing to do with this, let this place run on its own, I want my office managers to run it all, or whatever the case is, then you have that option too, right? If you want to kind of take a step back.
Definitely. I think that if you want to be successful, you really have to understand what you need to do and how you need to talk, how you need to run an office, and that just comes with time. And I think it's fun because they do a metrics page where they're kind of measured on stuff, so it's easier to keep track of how you can get better. So it's not like we're just figuring out business stuff. It's very much cut and dry. So numbers, and you can read them and you can calculate them. What I can do better in this mark, this and this. And when you get to enjoy it, it becomes part of the everyday excitement that you could just share with the team. And it becomes a fun part of the day. The business is part of everything. And I love the business part. That's why we wanted to do these types of things. But if you wanted to be, if you're an associate or MCD or even an owner-ish, I feel like most owners will be involved in the business, but you don't have to do that part as long as they give you everything you need to do to be successful. But if you take one more step, they make it super easy to learn how to really run an office and make it extremely successful.
Love that. Okay, so what does a typical day look like for you? Morning to night, being not only a dentist, but a business owner. Who wants to take that? Dr. Sharma.
There's nothing called as a typical day.
As Dr. Saman takes a swig of her wine, not a typical day.
This is what a typical day looks
like. You enter the office and then jokes apart. I think a typical day in our office is, we start with what we call as a morning huddle. We get together, the whole team gets together. We talk about our day. We talk about our previous day. We celebrate wins. We talk about things that we can work on. So try to start our day on a very positive note. And then as the day kind of goes by, it all depends on, lots of times people ask how many procedures you do, how many patients you see, how many, those questions are very broad. On an average, there could be days that I see 40 patients, but I'm not working on all 40 patients. I'm probably doing a quick check somewhere. I'm just checking healing on someone. I'm just talking to someone. And procedure-wise, I'm probably doing 4 or 5 procedures, depending on what procedures I'm doing, how long it takes me. If I'm doing a major surgery, I need more time for it, depending on all that. And then you learn multitasking. That's basically what it comes down to, because you're going to be seeing new patients. You're going to also take care of some things on the side. Somebody needs a quick denture adjustment. Somebody needs just, a quick hygiene check and stuff like that. So that's how a typical day is. We do have our designated lunchtime. We try our best to get it, but I'm not a big person on lunch, so it doesn't matter a lot to me. And then, of course, we try to finish on time, but healthcare things sometimes I leave early, sometimes I get to stay. So just kind of goes like that. So, but it's a fun-filled day. We also have a lot of when you have any downtime, we love to enjoy with the team. The team tries to have lunch together. Of course, keeping 6 feet apart these days. But it's a fun-filled day. It's always a roller coaster ride. Some things go really well. Some things we try to learn from and work on it and get better.
So there's no such thing as a normal day. Every day is different.
Different.
Okay. So have any of you ever had to deal with sexual harassment from a patient as a woman dentist? And if so, how did you handle it? Anyone?
I wouldn't say sexual harassment. I would say I've had patients who have borderline made inappropriate comments, but that's my favorite part. I dismiss them. That's it. If you are not going to behave, you have every authority. My team needs to be respected. I need to be respected. No money is worth any of this for anybody to pass any kind of mean comments to you. So we have protocols in place. When somebody does have something like that, if it's a smaller thing, we can always warn the patient and very professionally ask, like, this is not acceptable. But if people are not listening, ta-da, bye-bye, you are dismissed from the practice.
Yeah,
absolutely.
Awesome. What are the most common procedures that you guys are doing? Let's ask Dr. Khadija, since she has her whole new practice. Dr. Khadija, what are your most common practices or most common procedures?
Well, just any dental office, the bread and butter of dentistry is obviously the hygiene and the fillings, which nobody likes to do, but we got to do it.
Ask her how much she loves it.
The day, I've told this to Dr. Sharma already, the day that she gives me an associate, I'm never doing a filling again in my life.
The best
thing hire one person just to do fillings. I should probably not say that right now, but
we have a lot of D1s on. You don't want to scare them.
No, I'm not scaring them. This is bread and butter of dentistry, you guys. You have to learn it. You have to, and trust me, the more you do it, and there is no practice where you're not going to do fillings exclusively. You have to make peace with it. You have to get better at it. You're in a very good situation right now. Do as much as you can. Take very good advantage of this time. If you have 3 hours, because usually in pre-clinics, you have 3 hours to do these things. If you were supposed to do 1 or 2, do more, make use of this time, because whatever you learn right now, it's going to really help out when you are actually out there in your real world, because things run a lot faster. Dental school is really different than your private practice, and it is something that you get adapted to again really fast. But yes, in our practice, it's more advanced because we have like Dr. Sharma that does implants, so we do heavily on implants, a lot implants that we do. We have oral surgery as well. We have an endodontist as well. So it's, in a regular practice, it's like that. When it comes to me, obviously the fillings and extractions and dentures, and these are all the bread and butter of dentistry that we do. So it's always there as a standard in all offices.
Awesome. Now we only have a few minutes left, guys, and we have so many questions. So
Let's go.
I mean, if you girls are wanting to stay on with me just for a few more minutes to answer, obviously there's no obligation if you guys need to jump off. But the questions are really like flowing. There's so many. So let me continue. I'm going to ask 2 more. Again, if anybody wants to stay on, you're welcome to. So here's a good one. How did you all gain the confidence to know that you can run a practice or multiple practices and maintain your personal life and or raise a family all at the same time? Dr. Sharma, you just went from 1 to 2. Dr. Saman, you just went from 1 to 2. What are your secrets?
I'm only a week in, so maybe Dr. I'm still trying to figure out how to do both. No, but I mean, the confidence part just comes in with the success of the office. I mean, once your office gets to a point, and then the staff and the patients constantly are reassuring you, you're amazing, this is amazing. Those are the confidence points. When patients are crying in your arms every day, not every day, but almost every day, you get somebody in that emotional in a happy way about the experience they've had. Those are confident points. And, everyone that walks in the door and all the reviews and all the staff, and those are going to build your confidence. And the dentistry will come later, the physical skills, but being able to communicate and talk and to have compassion and talk to patients. And once you get confidence in that region, like treatment planning and discussing things, and that is when you get the confidence, but you'll know when you get it. It's just going to take time, and no one's going to jump out of school and just know everything. I mean, it takes time, and you have to understand it. But I wanted to make one thing before I'm going to hop off in a couple of minutes, but the one thing I wish I did when I was in dental school was actually do other things besides just dental school. So whenever we had breaks or time, I wish I worked as an assistant, spent more time in the real dental world. I know you guys sometimes have a little vacation, maybe a couple months, maybe a week. If I was a DA, because I have a couple of DAs that are now in dental school, and they literally are number one in everything. They do everything so well, and they understand the patient care and the communication and the type of patients they're going to see, and the type of diseases, and the type of, if you can grasp a little bit about the real world, it's going to help you soar through dental school. Shadowing is fine, and some people aren't going to hire you always, but if you have a family friend or somebody who you can spend a lot of time with, or just even learning about it through podcasts, there's so many dental podcasts, just gaining that knowledge. And school was so hard in itself, and whenever I didn't have to be doing school, I definitely wasn't doing school. And I really wish I utilized those teachers and those other people outside of dentistry, and going to work in offices and spending my summers or doing my vacations, just gaining more knowledge. It would have made the transition easier. It still happened, and it's fine. I know that I would have been more comfortable, and I have so many associates out of school that I've met, and you can kind of tell who really squeezed all the knowledge and who really went the second, the next level to learn from everyone else they've talked to. You basically just pick their brains. And, you have all these resources, just utilize it. This is a couple years of your life, but this is going to set you up for the rest of your life to just really focus on that. And learn from everybody, talk, ask questions, even message us. That there's so many of us on Instagram or whatever. We love to help, and it's just anything you can get. You can even visit the offices, and I love to train. I love to help, and those are things that I wish I did in dental school. I wish I was more, aggressive in the learning portion, especially outside of the school. Real dentistry is so different than school. But anyway, that was my little comment. I don't know if I veered off, but I just wanted to make sure I said that.
No, I appreciate that. So do you need to jump off?
Yeah, I do. But
Do you have a hot date?
I do actually, but I have to go get ready. So you can have a life and own 2 offices and go on dates. It makes it more exciting. Honestly, I feel like ever since I opened the second office or started to, you just have this more excitement, and life is good, and it's hard during the day, but once in a while you can have a glass of wine. But I mean, I'm so excited. Anyone wants to contact me, I have an Instagram and anything, I've been doing Invisalign and the Botox and all those fun stuff. So if you ever want to contact me, I'd be happy to talk to you. Thank you for having me.
Thank you so much, Natalie. I'll share your information with them just in case anybody wants to reach out. Anyone from Michigan, you guys want to reach out to Natalie. She's fantastic. You guys want to shadow or go see one of her offices. She's great. And I'll share all of your information with them.
Thank you guys.
I want to know about the date later.
We'll find out about the date after Dr. Sharma will send her a text.
We'll talk to you guys soon, okay?
Bye.
All right,
Bye.
good night. Have fun, be safe.
Thank you, always.
Okay, bye. All right, so we'll try to get through a few more, guys. I know that it's past the time I said, but if you want to hang on tight. We have one for Dr. Khadija. Dr. Khadija, what was it like transitioning from your education in Pakistan to the United States? Also, what part of Pakistan is your family from? I think the student's family's from, is it Lahore?
Lahore. Okay.
Lahore? Okay, awesome.
My family is from Karachi. I was born and raised in Karachi. My education was there as well, was from there. So the transition was for me, I came here as a married woman and all that stuff. So I had to do whatever other people do. But the thing is, because my, I had spoken really, I guess, very keenly with my husband that I have to do this. I have to do this. When I go there, I don't want to waste time. I want to work, and then I want to build up my resume and do all that stuff. So I guess it was somewhere back of his mind. As soon as I got here, he actually helped me build up, upload my resume. And then I actually I was not even here for a month and I was already working. So I was, he saw, it's just that you got to, if you feel like, let me enjoy my life a little bit. I just got to this new country. I don't know how to drive. I don't know how to do this. I don't know. I was not driving then, but I started work and I figured something out. And like Natalie was saying earlier, I did gain some experience as DA to be committed to the field and stuff like that. And that's how it happened. And like I said, I never decided to put my life on hold just because I wanted to educate myself further. I didn't think that my personal life should be on hold, and I was able to do it. And I think everybody has the capability to do it. So don't get discouraged if something comes up in life. The transition is as easy as you want to make it. I did take all my exams and everything while I was, growing my family, and went to school while I was growing my family. It is definitely doable. The transition it's hard. I'm not going to say it's easy. Dental school is hard on its own, especially if you have to move across the world and do it all over again. It is hard for sure, but it's doable. So the transition wasn't bad, honestly, because I did have support.
Awesome. So these two questions are very similar, ladies. So I'm going to ask them both, but you can combine them. What is the difference between owning a private practice versus owning an Aspen? And what do you think are the benefits of choosing one over the other? And then the next question is, what are the perks of working for a corporation like Aspen as opposed to a private practice? Have you ever experienced, do you have any experience with both? And how would you compare the two? So private practice versus Aspen. Dr. Sharma, how would you answer that?
Well, isn't that my favorite question?
Yeah, always.
So I think I have not worked in a private practice, but I can tell you because I have been in the industry for long enough. I have a lot of friends who have done both. I have a lot of doctors who have done both, who have left private practices and come, and vice versa. The honest answer is it's not either of these are for everybody and anybody. It just comes down to what makes you happy. I have always, even when I interview doctors, I always tell them one thing: whether you work in a private practice, whether you work in a DSO, whether you work as a partner, at the end of the day, it is your dentistry that matters, right? The place that you are at does not decide what kind of dentist you're going to be. A lot of people think that, you work in a corporation and you have to do dentistry different way. No, absolutely not. You maintain your own standards, and of course, you have to be ambitious if you want to grow and if you want to be better. Um, there's difference between maintaining the standard of care and at the same time being efficient, right? You do realize people, when they come into your offices, they're not going to spend 4 hours to do an exam. So being efficient, is one of the most important things. So the perks that you get for working in a DSO and as a DSO like Aspen, number one, there's a constant support. The One of the things that doctors do cherish is this mentor-mentee relationship. Um, you grow at your own pace. Anytime a doctor starts in my office, we let them decide their pace. Some people are very fast learners, like Dr. Kajeja. Her wings were spread from the very beginning. Some people take their time. You grow at your own pace. My job is to support you and let you grow at the pace you want to. So I think that's the most important thing. And I will tell you this from my personal experience. When I started, we did not have a mentee-mentor relationship like this, and I was on my own. And it was hard. It was really hard because I had to figure things out on my own. But we learned from that, and we've grown so much that whether you start with a practice owner or wherever you start, you'll always train with someone for a limited time, and that person will be always a constant touch. And even after you finish that, you have a huge network of doctors that you can reach out to. Like, I talk to doctors in Florida all the time, and in Philadelphia all the time, all these owner doctors. I pick their brains about something. We discuss cases, we discuss complications, and then learning environment. I never did Invisalign in my life, not in school. I started doing Invisalign 2 years ago, and me and Dr. Khadija, we're rolling as a platinum Invisalign provider. We do cases in and out, and I would never have been able to do that if it wasn't for the training and support that I got. Same thing with implants. We have an internal training. We have a great mentor who teaches us this course, and I talk to him pretty much every day. We do implants wherever. So there is so much in terms of constant learning and growth and support that you do get, which I don't think you get on your own. And I'm saying this because I have friends in private practice who do reach out to me and sometimes ask me things like, how would you do this? How would you do this clean check on Invisalign? So I think that's the biggest perks of it. And you do it the way you want. Like, nobody is going to come and tell you, this is wrong treatment plan and this should not have been done it. Of course, you will get a coaching, you will talk about it, like, hey, maybe we could have looked at it from a different point of view. And it's only because somebody who's working with you is probably a little more experienced and has learned from his or her mistakes and now is trying to make sure you don't make those mistakes. I've made so many mistakes in dentistry, so many of them, and I've learned from them, and I still am learning. Our profession, it's a constant learning profession. No matter how many days, I'm almost 8 years into practicing. I'm still learning. Every day there's something new that I learn. I learn from my new doctors. Sometimes, they tell me a new technique that is now being used in dental schools that I didn't know about. So that, I think, is the biggest difference when it comes to working on your own and working. And again, from my experience, I think Aspen has grown so well and has established itself so well that they have mastered some of these things that are very, very important, especially when you're graduating out of from dental school. There is a lot to learn once you get out of the school.
Well said, Dr. Sharma. So for those of you that don't, we still have a good amount of folks on. So for those of you that don't really know Aspen, especially our D1s, we are the largest branded DSO in the country. All of our offices, most of our offices are individually owned by our doctors, like Dr. Sharma, like Dr. Natalie Saman, like Dr. Khadija. And then we have some practices that are, you know, part of a large group practice, but every single office is individually owned. So you work alongside your owner doctor, whether or not your owner doctor, like Dr. Sharma, will be your mentor. You have a 4-week mentorship program when you come out of dental school. So I mean, it's very different than a private practice, because in a private practice, you might be working alongside the owner, and that owner has their own patients. They're not really going to take their time out to really train you or mentor you, possibly. But with us, we do offer you 4 weeks of mentorship to make sure that you are comfortable, you are working alongside, you're getting the right mentorship, you're getting your hand skills up, but you're also learning, you know, how Aspen does things. And like she said, if you guys have a difference in treatment planning, or if you think something should have gone one way, or she said, I think you should have done something this way, that's a conversation that you have with your mentor, always, always. So there's tons of growth. There's tons of opportunity for CE courses, for, you know, education. Dr. Sharma did my Invisalign. Look at these perfect teeth, guys. Look at these perfect teeth. And I know Dr. Khadija helped with my Invisalign too. Loved it. And you know, you had the opportunity to learn Invisalign. Now you're killing it in Invisalign. And now we are implementing implants, and tons of our doctors and our owners are getting trained. So it's just constant new technology. And the fact that Aspen is so, you know, established, we've been around for 22 years now. We have those resources. So, I mean, I think it's, I'm not going to say it's a no brainer, but we have people that come from private practice all the time that say that their experience was completely different. So, but obviously guys, you guys are welcome to shadow at any time. Okay, we're going to take one more question and then we're going to wrap it up, guys. If I didn't get to your question, I think I got through mostly all of them. Please, you're welcome to reach out to me directly. But our last question is, I heard that dentists working at Aspen Dental have so many patients a day. How are you able to provide attention and the standard of care needed for each patient? Also, adjusting to this kind of schedule as a new grad. Dr. Sharma, you just said you saw up to 40 patients a day. Elaborate on that.
So I think I did just cover this earlier, but I would say that again, that, you know, at the end of the day, one thing and the most important thing that I have always maintained in my practice, that the standard of care never goes down. Okay. If my patient needs me to be there with them and talk to them for an hour, I'm going to do that. Even if things are waiting, that's okay. But I think what starts happening is, as you grow, you do get faster on doing things. You know, it doesn't take me 2 hours to do a filling anymore. It doesn't, like, you know, so as you grow, you start learning and you speed up. And again, as I said earlier, when I say speed up, it doesn't mean that you're doing a bad job. You're never going to do a bad job, because I want you guys to remember one thing. Dentistry is a profession where if you make a mistake, it's going to come back to you. It's going to haunt you. Okay. I just want everybody to remember that we would not have survived and we would not have been at the positions that we are, if we were not maintaining our standard of care, and if we were not maintaining the right treatment options. Because you do a crappy filling and it's going to come out. Who's the patient going to go to? He's not going to go to a dentist across the street. He's going to come back and yell at you, right? So you don't ever want to be in that situation. You want to maintain your standard, but you also want to grow and be more efficient, because when people start coming to your offices, they are not going to expect to be in the chair for 4 hours to try to do one crown prep, right? They're not. They want to be in and out. They love you when you take 5 minutes and you take a tooth out and they are jumping out of the chair and they're like, that's it. That's what it is. And that's what makes you a better dentist, you know, trying to be able to provide that to your patients so that they don't feel that this was a hard experience from them. As such, people don't like going to the dentist. Why make it harder for them? You know, our job is to make it easier and make it more comfortable for them. And then be part of it. Just as I said earlier, you grow at your own pace. Yes, nobody is expecting you to run the schedules at the pace I am running, because when you graduate out of school, no, we take your time. And we slowly add on more responsibilities as you feel comfortable. That's the goal. The goal is not to put all this burden on you and make you feel like, oh my God, you've got to see 40 patients. No, it's not like that. We all work together. We share it. Right now, I have two more doctors with me. When Dr. Khadija was here, I had two more doctors with me, and we all just share the workload on an average. Yes, the practice might see that many days, but individually, not that I'm seeing all these people. So as I said, sometimes it's just a quick check. They're coming in for a post-op check, for a suture removal or something like that. But I make sure that none of my patients feel that it's rushed. Even if I am faster at a procedure, I want my patients to be happy. I love spending time with them. I know their personal lives. I ask them everything about what's going on in their life, and I spend time with them, and I build those relationships. And that really matters, because they're going to remember you if you connect with them on a personal level. And that's what's going to bring them back to you.
Love it. Okay, ladies, you guys have been amazing. We have surpassed our time. I'm so sorry. We had so many questions. We still have one question left. I don't know if you guys want to answer it, but Dr. Khadija, this one's actually specifically to you. Moving from MCD to owner, have you just taken on a lot? What was your workload like? Have you taken on a lot more work hour-wise? What's shifted? Or do you feel like you're kind of still still working the same?
Well, I'll answer this question, but just to be clear, I'm not an owner.
Well, partner, per se.
I am an MCD. I transitioned from associate to an MCD. I will tell you this, for anybody who thinks that I don't want to see that many patients, I don't want to do all that. When you get out of school, like they've been saying, Dr. Natalie and Dr. Sharma has been saying, dental school doesn't teach you half the stuff that you're going to learn outside. As a clinician, the best investment you can put into yourself is your clinical experience. Do it, go crazy, hit the floor running, do as much as you can in the beginning, push yourself as much as you can, go join a DSO, see 40 patients. That is not gonna, if anything, it is gonna make you a better clinician in the end of the day, because if you can do it now, you will just get better and better and better. That is what I will tell you. The workload wise, honestly, in the beginning, so we work so much earlier in our career, earlier in our life, so that we don't have to do it forever. I'll tell you my story. I told you how my experience was in school and everything. I started in Skokie. If you guys don't know about Skokie, out of 850 offices, it is one of the top 10 offices with Aspen. So you can imagine what kind of procedures we do, the amount of different procedures we do, and the variety of things that I've learned. And then Dr. Sharma, the mentorship that you guys were talking about, the confidence is something nobody can teach you, honestly, but the knowing that there's somebody there with me, and an excellent mentor, and somebody who is so good themselves, I know that if I get stuck somewhere, she's there right behind me, helping me, supporting me, which she did. I've done crazy procedures. I've done horizontal impactions. I've done so many things, tori removal, things that you don't imagine doing in school. I've done it without doing it before. I did it in a practice, and I do it now without blinking twice, you know what I mean? So I did all these things in the beginning there, and I actually worked, believe it, a lot more as an associate versus that I'm doing now as an MCD. And you know why? Because this faith was put into me, because I did all that in the beginning. So right after school, I did it, and asked Dr. Sharma, like 4 weeks you get to like train and do all this, and you are not expected to do much. I was like, I am not that person. I'm ready to pull my hair. Please give me some work. And I started working like 2 days later, and she's like, okay, there you go. This is gonna be a person that can be my partner, that can be a person that I can trust. And she gave me her brand new office to manage, which is not really a small thing. I feel very proud of myself because I pushed myself to that, and I was like, okay, I can do it. So work-wise, honestly, don't get discouraged from it. Don't shy from it. Do it. Take more work. Do as much as you can. Push yourself. Maintain the standard of care, like Dr. Sharma was saying. build your pace, but do not say like, okay, I'm gonna go see 5 patients a day and all that stuff. But let me tell you guys, being practical, from a practical standpoint, there is no such thing. If you're living in a bubble, if you think like I'm gonna work less and make more money, that cannot happen. That will never happen. If you want to get 20 grands home every month, you have to work hard. Okay. And the more work you do in the beginning, it's going to help you, because you're not going to have to do that much work because you're successful at that point, or you're not going to feel that you're doing that much work because now you're an excellent clinician and you're doing everything in half the time that you did before. But so for my experience as an MCD, I'm definitely working less. I am managing more other aspects of dentistry, the business aspect of it. I'm learning it. I'm learning a lot from Dr. Sharma. And these are the things, these are that transition. But I feel like in the beginning of career, everybody should do it. If you learn Aspen model, there is nothing in the world that you can't do. That is what I feel. If you can do that, then you can do anything. So,
no, I mean, I do want to give a huge shout out to Dr. Khadija. She is amazing. She's not admitting it as much as it is, but
She's being very humble on here.
her. I mean, just imagine she's 2 years out of school, barely 2 years out of school, and she's managing the practice on her own. She's there every single day. I'm not there with her to tell her everything, but she's managing it from front to back, and it's because she did it. She wanted to do it. She is a very fast learner, and she had that goal and she had that ambition. So if you have that, nobody's going to stop you. And it's okay if you don't want to grow at that pace and you want to take your time, that's completely how you want it. But just as she said, in your beginning years, those are your formative years. Learn as much as you can. Try to put your hands. Where else are you going to find a situation where you're going to be like, hey, I'm going to try this today. If I get stuck, would you bail me out? Right. You really need that when you get started. So again, thank you. I'm also, I think, now past time. So thank you so much for having us.
Thank you guys so much for being on. You've been absolutely amazing. I mean, we have a couple comments. You guys are big bosses, obviously, and you're inspiring. So, I mean, you guys are fantastic. We have 2 amazing owners. We have Dr. Khadija that just went from an associate to an MCD, and I'm hoping that you're going to be an owner soon as well. But I mean, I want to say thank you so much. You guys have obviously been, close in my heart, because I was in Chicago and I would go see you guys all the time. And I know that you guys are doing great things, and it's only up from here. So thank you so much for being on. Before we jump off, I'm going to have you girls give me 3 numbers, because we're going to pick 3 numbers, 3 lucky ladies or men. I'm not sure if we have any guys on here, but we have 3 Sephora gift cards that I'm going to raffle out for $100 a piece.
oh,
I love me some.
can I be part of it? I just spent $200 today on Sephora.
I may throw you guys a little something for being on tonight. Okay, so Dr. Sharma, give me a number between, we still have 30 panelists or 30 girls on. So give me a number between 1 and 30.
16.
16, all right. Let's see. Laura Habib, you're my first winner. Shoot me a message, congrats. Throw in your information in the chat with your email address, or email it to me directly so I can send you your Sephora gift card. Good job. Dr. Khadija, give me a number between 1 and 30. Just not number 16.
12.
12. All right, so let's look number 12. Number 12 is Kaylee Mincy. Kaylee, congratulations. You got yourself a $100 Sephora gift card. Woo woo. All right, and then Dr. Sharma, one more number between 1 and 30.
27.
27. 27 is Sayyida Hassan. Sayyida Hassan, you are 3rd lucky winner. A $100 Sephora gift card. Congratulations, the winners. Please shoot me a message. You can either send it to me directly, or you can put it in the chat. Just give me your email address and I'll send you guys out those gift cards. Ladies, you've been fantastic. Thank you so much for staying on extra. We, ran extra because they were asking all these awesome questions. And if you guys are okay, if you're okay with me sharing your information,
Absolutely.
I will send everyone that jumped on tonight, I will send you the recording. So if you want to go back and listen to it, you can, as well as Dr. Sharma, Dr. Saman, and Dr. Khadija. Do you have an Instagram or anything?
I do.
Okay, awesome. If you're okay with me sharing your guys' info, that way they can reach out to you. If they want to shadow, if they want to just chat with you and ask you, pick your brains, that would be awesome.
Sure.
But thank you so much, ladies. You've been so great. I love you both very
Thank
much
you.
for being
It's
on.
a pleasure. Thank you, Becca, for having us. Good luck to everyone. And if you ever need anything, we're always welcoming. We're a happy family. Let us know, and maybe we'll see some of you on the other side of it in Aspen.
Absolutely. Hopefully we see some of these ladies as our future panelists in our next Women's History Month.
Hey.
All right, girls. Thank you so much. Everyone have a good night. I will send out those gift cards here shortly, okay?
Bye.
Thank
Good
you.
night, everybody.
Bye.
Night.
Have a great night.